of health. It's 5 years of continuous learning since we started the cycle of webinars in 2022. It is great to introduce this webinar in coordination with the Copenhagen Institute. Before starting, remembering that in 1971, with the creation of the Latin Agreement, the governments of Bolivia, Chile, Colombia, Peru, Venezuela joined with a sense of solidarity and integration to make of health a bridge for peace and working in the well-being of the population. So this organization and the agreement in Polidunani has a very important unity trajectory and a constant work with the ministries of health and the other countries to materialize the rights of health. In the pandemic, the pandemic reaffirmed the importance of the health sector for the well-being of the population. That's why this is a priority to keep health in the center of the policies and social awareness for well-being to work on care for life. Health is a bridge for integration and health. Without the right of health, there's no right to life. So reflections on the actions that we develop, you can find them in our bulletin that is issued every month that we invite you to read, and that is available in the website of the ORS CONU and in our media. Please leave your name and organization in the comment chat box. In that same space, you can leave your questions or send them through email to access to the certificate in any of the Facebook chats. You will find a fixed link where you can fill a form and you can leave your data to be sent by email. Please verify that your email is properly written for the for your certificate that will be sent at the end of the week. In this webinar, we will start with institutional greetings. We will pass to conferences to create a dialogue between the questions of the participants. So to start this important work, we would like to leave you with Dr. Maria del Carmen Davila, Secretary, for the opening remarks. Yes, Dr. Calle, welcome. Thank you very much. If you hear some noise, please don't mind it. I just wanted to provide you with the opening remarks. Good day, good afternoon, good evening, wherever you are. In behalf of our organization, it is a pleasure for me to welcome you to this webinar that we perform next to the Copenhagen Institute for Future Studies, is speaking about happiness as an indicator of health. Also, the progress of the country should be measured through the gross internal product. But we recognize that the well-being of the populations transcends economic indicators. Happiness, understood as well-being, constitutes a basic component for a full and healthy life. In Horace Konu, um, we promote the health of the population, and our strategic lines include um, uh, health as a center of the axis and the reduction of inequities. To speak about health, happiness as an indicator of health is in line with this comprehensive vision. Health is not limited uh, to certain aspects, but includes a comprehensive approach that allow people to develop and thrive. Happiness is a main part of this. So there are several tools and scopes groups to measure this at the national and international levels. Um, the World Report for Happiness, for the World Happiness Report, for example, created by the UN. The factors assess include social support, availability, well-being, and access to quality health, to be able to decide, generosity, and to assess. It is important to mention that we are leading this ranking for 2 consecutive years, what allows us to support public policies. And there is this connection between health and happiness. Happiness generates many benefits that are physiological that translate in better levels of well-being associated with lower blood pressure and other cardiovascular improvements and strengthening of the immune system as well, actually reaching to induce the production of telomerase that is antagonist or it reduces aging in the cells. This connected with good patterns of sleep. And these are part of a series of strategies that translate in a more longevity, as it has been shown by studies like the Harvard study on adult development that confirms that people with high levels of happiness and solid relations live longer and they have better health. Now, how health constitutes or a good health allows you to participate in activities that provide you pleasure and purpose, where you reduce chronic pain and improvements in mobility that become key aspects in well-being. And it does help us to improve or confront the issues of life. If we have chronic diseases, this can reduce the levels of happiness, influencing or highlighting the importance of keeping a good comprehensive health status. Today, we will analyze how happiness represents a smart strategy to build healthier societies that are more resilient and productive. We have the participation of two experts in this field, Dr. Brandt that will share his experience. And Berta Luz Pineda, sociologist. coordinator of the Andean Working Table consultation against inequities in health. So I'm sure that their presentations will provide us valuable input to continue working in the in this comprehensive effort. Thank you for your valuable collaboration with this workshop and for thank you for your active participation. Welcome to all of you. Thank you very much. Thank you, Dr. Kaya, for that greeting. Continuing with the institutional greetings, I would like to um, go to Dr. Boy Jansen. Dr. Boy, please. Thank you very much, and thank you very much to you for covering this very important subject and providing space to Professor Bengt. And I think we are very proud of having such experts in this area, in this event. And also for me, it's also important to add, as in many other workshops, how can we have health as the main axis in society and well-being and happiness are key? How can we work with happiness? And I believe that today, more than ever, as it was mentioned before, with the crisis that we have and what is happening in the world, it's very important that we understand what are our priorities. Definitely one of them is being good, and how can we use happiness as a parameter to improve our societies. And with that, thank you very much, and um, I hope that we have a very fruitful discussion, and also from our side, we are also very proud of collaborating with you. Thank you very much, Dr. Boyi Eliansen. Always good to hear you. Well, now, after the institutional greetings, I would like to introduce myself. I'm Jadia Salas, Education Coordinator in the Ande organization, and I will be in charge of moderating this webinar. Today we'll explore how happiness goes beyond an emotion and becomes a comprehensive part of our health. Now, today with you, Professor Ben. Dr. Bengt is a Danish academic and specialized in social policies and well-being. He studied in the University of Copenhagen, graduated in 1977, and then he achieved the degree of doctor in 1992, and in 2002, doctor studies in public administration, consolidating a solid academic formation in social sciences. He has had different positions. He worked in the county council and the economic labor unions, and he was also the chief of secretariat in the Danish Council for Journalists. And he became part of the Roskilde University, where he has developed a academic trajectory. Many highlights. He was named social science professor with a very specific scope in the study and analysis of well-being in the status and societies of well-being. For more than 12 years, he was dean of the institute in this university, and throughout his career, he has produced a wide array of publications. This includes include a number of articles, international magazines, and several books that go into deep around social security, well-being, and public policies in Nordic countries and European countries. It is a pleasure to have you here, Dr. Bengt. Um, the floor is with you.
Thanks very much. Thanks for the invitation to say something about happiness. Perhaps I should say first that the Nordic countries, all 5 of them, has in all years been among the 10 happiest countries in the world. So there seems to be something in relation to the welfare state having an impact on your level of happiness. And this is my starting point because I think it implies that it's not just health, which is important, it's also the more general framework of the welfare state. I've sent you some PowerPoints. Have you got them?
Sí, adelante,
can
por
you
favor.
see my PowerPoint? Because I can't see them on the screen.
Todavía no lo vemos, doctor.
Yes, we cannot see it yet. You are able to share it now.
¿Tiene abierto su PowerPoint?
Okay.
And
Well,
share?
I sent it to someone who I thought has shared them. Can I share them? Because whiteboard docs notes. That's strange. I mean, we were so used to do this when we have the COVID-19, but suddenly we forgot how to deal with this. At that time, we were all, I think, expert in doing this one. But share,
Sí, si tiene muchos inconvenientes, doctor, lo podemos poner nosotros. Usted me indica.
If you're having technical difficulties, we can do it for you, but I think it's showing just now.
Showing now. Yeah, I can see it. You can see it. That's great. So,
¿Puede
just to
ponerlo, por
be
favor,
clear,
en pantalla completa antes de que
Could you use full screen mode, please?
Yes.
Muchas gracias.
Thank you.
And I come from Roskilde University, as said, so just to make sure that this is part of what I'm doing. This one is a book I wrote a few years ago and all the dots are all European countries, and they say something about how is people perceiving their health and the life satisfaction. And as you can see, there's a clear connection between if you think you have a bad health, you also have a less life satisfaction. And if you think you have really good health, then you also have a more happy and life satisfaction. So I'm not in doubt, and also has been said during the introduction, that there seems to be a clear relation between happiness and life satisfaction. There's one exception from that discussion I think one should be aware of. A lot of elderly people are in fact very happy. And they are, despite they're not having good health. Because they have been, but often the explanation is that even for someone with higher age still being happy, this is because they often have something good to think back on. So here, this is in general, but the reason why it's not so for all is that for some, there might be other issues than health. For example, having had a good life with children, grandchildren, been doing a lot of good things during lifetime, also have an impact on how happy people are. But nevertheless, this figure is a clear indication of that we can see a connection about health and life satisfaction. We have one issue, not only when we're talking about happiness and health, but in general, a lot of happiness studies shows a connection, but it's sometimes difficult to know the causality and whether there is causality. Or to put it another way, is it because you are happy you are healthy, or is it because due to you are healthy that you are happy? And which way this goes is an open question discussion, both from a theoretically and methodological point of view. But still, I would argue that even if we have these questions from a scientific perspective, it seems to be that we have some good relationship between these issues, and therefore So I agree, it's good to discuss what can we do, how can we understand it, how is it we can perhaps do something by the welfare state or by the public sector, whatever you would like to call it. So overall, as I said, that happy people live longer. Causality is a question. There was a study indicating this one. It was a nun study made by nuns attempting when they arrived in Chicago at the monastery, they all wrote a piece of paper telling their life story. And they all live, and that's the reason why it's a good study. They all lived in exactly the same condition, the same houses, the same food, the same type of work. And after they have been living there in many years, someone went back and looked at what was the mood of the different people when they entered the monastery. And those who have been in good mood live longer than those who are in less good mood. So this is, I think, a strong indicator of that the way you see life, the way you have as individual an issue, I think about it, this is something I think one can be rather sure about. So it's not only your day-to-day feeling, but it's also more generally the mood you are in, how you are related to other people, which I will come back to later on. So good health increase happiness. I think we can say that for sure. We also know, and have been known for some years, there's a so-called U-shape of age and happiness. Young people are very happy, then you are less happy when you're 40, 45, 47, and then it grows again. So when I talk about happiness in Denmark, and I talk with people who are busy on the labor market, taking care of the kids, and they feel stressed, I said, yes, but now you perhaps are on your lowest point of happiness, it will grow again. We have seen some also in the World Happiness Report seems to indicate that younger people are no longer as happy as they used to be. So we have some challenges here related to how young people's life are. They have perhaps education, labor market issues, whether they can find the way in life they would like to have. So there are perhaps something we should discuss here among young people, but we can, so to speak, perhaps do that another day. One other issue, even as said also introduction, that healthy people live longer than less healthy people. This relationship can be influenced by the level of income. This, as we know, for a long time, there is a relationship between income and happiness. Richer people are in general happier than less rich people. Of course, there is this diminishing utility curve, but nevertheless, we know there is such an issue. So it might be that part of the connection between health and happiness has something to do with the income distribution, the degree of inequality, the way people can have a life they would like to have and have buying the goods they will. And it also seems that people with higher income have, for example, can afford to have better food than other people. And this also have an impact on how happy they are. At the same time, we know, and where the nun study was one kind of it, but there's a lot of studies indicating that people who are optimistic, they tend to live longer. So that perhaps can also explain something about why we see a relationship between happiness and health. Also, as I think there was said in introduction, that happy people seem less prone to be depressive. And here again, we have another issue, I think, which is important also to be aware of, that social capital is important. So social capital, health, and happiness also interact. Such as, if you first become sick, then losing your social contact, then this will be negative for happiness. Also being an indicator of that one issue the welfare state can do something about is to, perhaps I should say, the welfare state cannot promise people happiness, but the welfare state can frame options that people can be together. And for example, ensure that there are places where people can meet each other, that there are places where people can talk together, and helping in that people have contact with other people can be one perhaps relatively simple issue to ensure that people are happy and by this can also have a good life. And again, about health and happiness, it seems that happy people have a stronger immune system, which help them to avoid preventable diseases. And perhaps I should also mention that, of course, even if we have this connection between happiness and health, there can be genetic issues which we cannot take care of, because even if we are perhaps the most happy persons in the world, if our genes have some elements not working, happiness can of course not do with that. But this doesn't imply that we should not try to think about it and try to think about where do we have something we can influence people's individual behavior for by nudging them or by supporting them. So it can be this, for example, can imply about social capital and social relations, that if we can ensure an active agent, so that can be important for happiness. And at least in a country like Denmark, where we have a relatively large old age care sector with a lot of support from the welfare state for the elderly, if people are actively aging, having a good life, are happy people, then perhaps we can reduce public sector spending in certain areas. So there will also be something about social investment and doing things which can help making it possible for people to have a good life. And what can we do else? Yeah, I mean, we can ban or we can put high duties on smoking. I just seen today that in Norway, and I think it was also in France, it will no longer be possible to smoke on the beaches because they want to have places where children do not see that the grown-up are smoking. It's perhaps not the most simple way to think about it, but it's an indicator of that countries have some way of thinking about what to do, and reducing smoking will improve health, and by this most likely also that we get a happy society. We have it. We also know from studies, and a part of this is based on my book here, Happiness, from 2000 and the second edition, 2020, 23. I looked into that when I rewrote, sort of made the second edition of that book. Do we know anything about being outside? Is there something with the way we live which can help us be more happy? And it seems, in fact, having open spaces, it can be a park, it can be in a forest, it can be on the beach. That can be an issue helping us be more healthy and more happy. It also seems if we can reduce noise, so people are not living in a constant noise, which can have also negative impact on your health, that might also improve your level of happiness. And better climate can also improve happiness. So there are perhaps some areas where we normally would not say this is an issue about happiness and health, but where there is in fact some relationship to be aware of. We can also say at least that it would be good to support healthy food. And more seems to indicate that having a healthy diet is important for being healthy. And therefore, again, we have a connection with happiness, because if you are healthy, you will most likely have fewer days of diseases. You will most likely be less stressed, and by this, most likely also be more happy. So in this way, it can be important. It also points to that prevention is important. Everything we can do to prevent people becoming sick is important. This goes from vaccination, as we saw under COVID-19, and we know with child diseases. It's something about how we can make people being active, and by being active, by walking, playing football, etc., that could have a good impact on people's health, and by this, most likely again, also on happiness. It is difficult. I have to say that, as it says here, how much and to what extent can it be difficult to estimate? But nevertheless, there seems to be a good case for thinking about something which we normally not consider health policy as being important for health and happiness at the same time. Walking in a park, enjoying nature can have a positive impact. If we can have good food, that's also important. And if we can support people so they know how they can live in a better way, this is important. By this, I'm not saying it's only the individual's own responsibility. I am in fact saying this is both a responsibility of the individual, but also of the state by helping making it possible to live a good and fulfilling life, etc. That what I would like to say, but I would like to end with saying in the first round that Bhutan was the first country to talk about gross happiness product. It is difficult to measure, but nevertheless, I think it's important to think about that well-being and happiness also make life better for many people. So even if we can't measure it in money, we can measure it in the way we think about our lives. Thank you.
Muchísimas gracias, profesor Ben.
Thank you very
Su
much, Brooklyn Ben.
perspectiva nos muestra que la
Your
felicidad
perspective
comienza
shows
con
us
pequeños
that
gestos abstractos
this
y
is not an
desarrolla
abstract
confianza
concept,
con
but
sus
a
decisiones.
tangible reality that
El
can
cambio
be
cotidiano puede
cultivated
cambiar
through
vidas. Además,
well-designed public
discutíamos y
policies. Your
reflexionamos evidencia
analysis
científica sobre cómo
offers
la
scientific
emoción
evidence and showing the connection
colectivamente
between
produce
collective
procesos de salud y
um,
felicidad en
well-being
nuestro
generates
la buena
a
salud
virtuous
aumenta la
cycle
felicidad, los
and that
optimistas
improves
tienden a vivir más
health.
tiempo, las
Optimist
personas
people
felices
tend to live
tienden
more,
a
and
tener
happy
una mente
people
más fuerte.
tend to have
Entonces,
a
esta
stronger immune
reflexión
system. So
también nos
this
invita a
reflection
construir
also
sociedades
invites
más
us
felices y
to build
saludables.
more
No
happy and
vemos
healthy
una
societies, and
opción
it's not
intervenida, sino es una estrategia
more
inteligente de
imperative, but
desarrollo
it's
sostenible
a
que
smart
beneficiaría a los 10 países de la
strategy that
humanidad.
will benefit the
Estimado
community
doctor
as a
Ben,
whole.
les
Dr.
invitamos a permanecer
Bengt,
en sala
please stay
porque
in
luego de esta
this
experiencia
session because
en el
after the
espacio
conferences,
haremos un
and
breve diálogo para
we
responder
will
las
have
preguntas de los participantes, que será como la
space
segunda
for
parte de
question
este
and
webinar.
answers. That will be the
Así
second
que
part of this
muchísimas
webinar. So
gracias por
please
esta primera
stay with us
intervención.
and thank you very
A
much for your
continuación,
intervention.
le voy
Now,
a dar la más
I
cordial
will
bienvenida
leave you
a la
with
magíster Berta Luz Pineda.
Magister Berta
Berta Luz
Luz
Pineda
Pineda,
es socióloga con especializaciones en
sociologist
desarrollo sostenible,
specialized in sustainable
gerencia ambiental,
development,
interculturalidad y
environmental
migración.
management,
Tiene
and
maestría en gerencia de
migration.
proyectos
She
y programas sociales
studied project
y un diploma
management and
superior
social
en
projects
políticas,
and a
salud
diploma
internacional y soberanía
on international
sanitaria.
health.
Su primer trabajo como
Her
socióloga lo
first work as
realizó
a
en el Ministerio de
sociologist
Salud de
was made
Colombia,
in the
donde
Ministry of
desempeñaba
Environment,
como coordinadora de
Ministry of Health of
promoción de la
Colombia,
salud
where
y
she
desde
was
entonces ha
a health
continuado su trabajo en
promoter,
el
and
sector.
she has continued her
Trabajó
work in this
13 años como
sector. She worked
coordinadora de
13
proyectos
years
sociales
as
en
a
el Centro de
project
Investigación
coordinator in
Multidisciplinaria
the
para el Desarrollo de la
Multidisciplinary
Ciencia
Institute
Social
for
de la
if
Universidad del
the
Valle, Colombia,
El
13
Valle
años en la Secretaría Nacional del Ministerio
University
de
in
Salud de
Colombia,
aquí de España
and
para la
then
coordinación de investigaciones sobre la situación
Spain
de salud de la
and
población migrante y lleva 10 años
in
en el Organismo
migration
Andino de
issues.
Salud
She is
SEDIN.
working in the
Actualmente
and then
coordina el
organization.
Departamento de
She's
Gestión de
coordinating
Desastres y Cambio
the
Climático
Disaster
de Comisión
Management and
Interministerial
Climate Change
Conjunta de la
Committee
Mesa Andina
and
Intersectorial de
the
Concertación contra el Uso
Intersectoral
Ambiental Pesticida.
Andean
Estimada
Board
magíster Berta,
against
es un placer contar
Health
con su presencia en
Inequities.
este webinar, así que puede por
Professor
favor
Berta
iniciar su
Luz, it's
presentación.
a
Adelante.
pleasure to have you
Muchas
here.
gracias, querida Yadira.
Thank
En
you very
primer
much,
lugar,
Adita. First of
agradecimiento
all,
por
thank you
invitarme a este
for
webinar tan
inviting me to this
interesante para la
webinar,
salud y
and
bienestar de la
also
doctora María del
greetings
Carmen,
to Dr.
equipo del
Maria del
Organismo Andino de
Carmen,
Salud, al doctor
the
Ben,
team, to
al doctor
Dr.
Boyd y a
Bengt,
todas las
Dr.
personas
Boji,
que nos siguen y
and
están
everyone
participando
who is
en el
following
webinar. Voy a
this
compartir
webinar.
mi
I'm going to
presentación.
share my
Eh,
presentation.
¿Me confirma, por favor, si la ven?
Please let me know if you can see it.
Muy bien, querida Bertita. Adelante, por favor.
En primer lugar, acogiendo la
First of all,
invitación de
um,
este tema tan relevante sobre la felicidad, el informe de este
the
año quiero
report
compartirlo muy
of
interesante.
this year
Su
has a
contenido
very interesting
requiere
content. The
8
contents
capítulos. El
include
primero
eight
es una
chapters. The
introducción
first
breve
is an
de énfasis
introduction,
en la
then
importancia que
an
tiene poder
emphasis on the
compartir,
importance of
compartir y conectar con
the
las personas,
sharing
vivir con otros,
with other people,
conectarse con los
living, eating with
demás,
other people, connecting with other
apoyar a los
people,
demás,
supporting
confiar en los
other
demás
people,
y dar a los
trusting other
demás.
people, and
El
giving to
informe
other people.
tiene,
The report
como ya lo he
has,
dicho, unas
as it
variables que
has
son
been
desafíos
mentioned, provides a
supremamente
set of
importantes para poder
variables that
conectar
are
un
very
aumento per
important and
expresa
the
en términos de
gross
poder
product per capita
adquisitivo,
that
que
expressed
da a la gente
in
contar con la libertad para
basically
tomar decisiones
income
libres y diversidad.
and also, but
Ser
also
consciente de la
generosity,
corrupción
the lack of
es una de las
corruption,
consideraciones y
the
un punto en el que me voy a detener un poco
emotions and
más con
effects. And
independencia
there's
de
another
la
point,
responsabilidad
which is
saludable.
uh,
Esta variable
healthy
nos
life
plantea desafíos
expectancy.
muy
This
interesantes
proposes
porque se
a series of
define como
variables
el
because
número
it's defined
promedio de
as the
años
average
que una
number of
persona
years that a
puede
person
esperar vivir
can hope
con
to
buena
live
salud,
with good health,
libre de enfermedades
free
crónicas o
from chronic
discapacidades. El
disease
desafío es
and
no
disabilities. The
esperar
challenge
lo
is
mejor
to
y
live,
vivir
but to
bien.
live better and to live
El
good.
informe, como ya
And the
lo
report,
dijo el
as it
doctor
was
Ben,
mentioned by Dr. Bang,
dice que los países
says
nórdicos
that the
lideran
countries, Nordic countries
en
lead
resultados, en primer
the
lugar,
results
ocupan los
in the
primeros
first
lugares
place
en los resultados en el indicador de
in
felicidad. Finlandia, Dinamarca,
Finland,
Islandia,
Denmark,
Suecia y Países
Iceland,
Bajos.
Sweden, and the
¿Cuáles son las
Netherlands.
características de estos
So, which are
países?
the
Su
characteristics
sistema
of
de
these
salud,
countries?
de educación y
Health
apoyo social
systems and
universales y
support
de alta
systems
calidad,
are universal and high
escasa
quality.
desigualdad en el
A
bienestar
lack
y menos
or
necesidad de caridad pública.
less
Uno de
inequities
los
and
elementos
less need
interesantes
for
en el informe,
um,
los
charity.
países con mayor confianza
Now, the
social e
countries with
institucional
more
tienen
social
menos
trust
desigualdad
and
que
institutional
otros.
trust have less
El informe
equity
documenta
or less
que esto
inequities.
aumenta la
This
desigualdad del bienestar a nivel mundial. Es decir, hay una gran brecha
So there is
en
a
los
important gap
resultados de
between the
los países que
results
están en
of the
primer lugar
countries that are
y
on the
los que
first
se
places
encuentran en el
with the
bienestar
ones
en los
that
últimos
are
lugares.
in the last place.
Además, el informe muestra que la
The report
desigualdad
also shows
en el
that
bienestar
inequity
no se
in
reduce.
well-being reduces
Yo me voy a
happiness.
centrar en
So I
convertirse
will
en
focus
estas
in
dos
this conference in
variables
these
en nuestro
two
desarrollo,
variables, in these two
esperanza de
topics,
vida saludable
life
y
expectancy,
el
healthy life
desafío
expectancy,
saludable
and
de la
the
región
challenge that
y para el
we have
mundo
for the
de
region
reducir
of
desigualdades y
reducing
crisis en el sistema.
inequities.
Hay otro informe que no
There's
puedo
another
dejar de
report that I
mencionar
would
y
like to
también es de
mention
este año.
that is
Es el
also from
informe de
this year,
desarrollo
which
humano.
is the Human
Este
Development
informe muestra
Report.
un
This shows
estancamiento
a
en relación con el índice de desarrollo humano en todas las regiones del mundo.
stop in the development in
Recordemos
all regions
que
of
el
the
índice de
world.
desarrollo
Let's
humano
remember that the human
analiza
development
los indicadores relacionados
index
con salud,
assesses
esperanza de
indicators
vejez
related to
y
health and
educación
life
basada en
expectancy,
utilización de
education,
adultos y
alphabetization
también la
rates, and
matriculación en todos
also
los niveles, primaria,
the
secundaria y
participation in all
terciaria,
levels,
y los ingresos,
elementary,
que es el
secondary
indicador per
school.
cápita ajustado por paridad del poder adquisitivo. Este informe nos
That
indica que hay
report
una
shows us that
desaceleración
there is
significativa en el progreso de desarrollo humano a nivel mundial,
deceleration in the progress of
alcanzando
humans
su
at the world
nivel
level,
más bajo en
achieving its
35 años,
lowest
y nos
level in
reitera
35
que las
years. And we
desigualdades entre
reiterate
países
that the
ricos
inequities
están
between
aumentando.
countries are
El informe
increasing.
destaca
The
que es
report
urgente abordar
highlights
las
and
desigualdades.
calls to
También quiero
fix
mostrarles
this.
que
I also want to show
no es
you that
coincidencia
it is not a
que los
coincidence
países
that
en
the
los mejores
countries that
resultados
had the
que
best
están en los primeros
results,
lugares en el
that are on
informe
the
de
best
felicidad,
places,
también están en los primeros
also
lugares
are
en
in the
el informe de
first
desarrollo
places
humano, en el
in
índice
the
de desarrollo
Human
humano. Como
Development
pueden ver, Finlandia está en
Index.
el
As
puesto
you can
2 en
see,
el índice de
Finland,
desarrollo humano, Dinamarca en el 4, Islandia en el
Denmark,
1, Suecia en el 5,
Iceland,
Países Bajos en el 8.
Sweden.
Entonces, la hipótesis muestra
So
que la
our
característica
hypothesis
de
is
estos
a
países
characteristic
es
of these
su
countries
estado de bienestar.
is
Cada parte de los derechos hace
well-being
que las
status
personas se
that
sientan
makes
mejor,
that
como
people feel
decía el
better,
doctor Ben, más
as Dr.
saludables y
Ben
también más
said, more
felices.
healthy, but
Nos
also
cambia para
happier.
nuestra amada región
Also, for
andina, los países
our
andinos,
Indian
Chile,
region,
Colombia, Ecuador,
Chile,
Perú,
Colombia, Ecuador,
Bolivia,
Peru,
Venezuela, pueden ver
Venezuela,
ustedes,
you can
no es que
see
estemos
that it's
en
not
los
that
últimos lugares,
we
sino
are in
se
the
nos
last
hace falta
places, but
muchísimo
we
para
do
mejorar en
need
relación con
much
los
to
resultados
improve
tanto en el informe
with the
mundial
results in the world
difícil como
report
en el
as
informe de
the
2025
report
del
of
índice de desarrollo humano.
2022 of the Human Development Index.
Entonces, mi
Now,
presentación la
my
voy a articular
presentation, I will
también con la
articulate
visión del
this
organismo andino
with
del
the
desarrollo.
vision
Primero
of
vamos a
the
tener ese
Andean organization, which is an integrating organization that integrates 6 countries and the strategic plan for 2030. We have its vision. The inhabitants of the region have inequities have reduced, and there is a much better capacity for joint response through the integration and regional cooperation. With this, I want to say that our emphasis or our uh, ha- or we can articulate it with very interesting concepts that are in the political constitution of Bolivia and Ecuador, to the well-being, the well-living. This is very important. I'm not going to stay there. This is related with living in harmony with nature, and definitely we are going to cover this in another webinar. My presentation also includes the reduction of inequities in health. As Dr. Ben said, we are more healthy, we reduce inequities, we have more well-being. As you can see in this slide, there is a map of life expectancy of the world level, and I would like to cover the idea that not only death arrives first for poorer people, also chronic disease start before. The evidence is there. Inequities kill. This has been present in 22 webinars that we have performed. In the webinar that we did in February, commemorating the World Justice level, Michael Marmot reminded us that social justice kills at a larger scale. And this was a concept that was present in the report by the Social Determinants Conditions in 28. In this important publication that constituted a, a very important point, it starts by saying that social justice is a matter of life and death. It affects the way in which people live, the probability of getting sick and dying earlier. We see that how life expectancy improves constantly in some parts of the world as we um, uh, hope that this doesn't happen in other parts. The expectancy of a little girl can be 80 years in certain countries, and 45 if she is born in another. So there are great differences that are directly linked to the degree of inequities. These differences should not exist in either in the country or between the countries. Let's remember that the Commission did work in 28 to 2008 with three main actions: improving life conditions, fighting against the distribution, their wrong distribution of wealth, and to assess the interventions. Now, the OMS has published a report um, of social determinants that have an effect on this. And then we have different perspectives, and we know that there is a current that allows us to speak more about social determination and social determinations of health. In a way, this is new. Um, and what is really relevant from this perspective, the importance of speaking about the causes that have an effect on health. And that report tells us that our world is unequal. The parental gaps in life expectancy are getting worse and worse in all social groups, which is shortening lives even for decades.
Vivimos, trabajamos y envejecemos. Y nuestro
And
acceso al
we
poder, el dinero y los
our
recursos
access
influyen
to
en nuestra calidad
resources
de salud más
have an
que las
effect on
consecuencias
our
directas
health
de
more
la
than
educación
genetic
médica.
or genetics
Continuando
or
con el
medical attention.
informe, nos dice, persisten brechas que son inaceptables.
There are gaps persisting that are completely unacceptable. How long can people expect to can wait to live a healthy life? Depending on where they live, the communities that they are a part of, their level of education, their ethnicity, their level of income, their gender, and whether or not they have a disability. The social determinants of equity and equality in health have a powerful influence on the unjust gaps in health. The health determinants are molded by political decisions, social values, and the systems that we create and maintain. So these reports propose 4 different paths of action. The first one is to deal with inequality and economic inequality, invest in infrastructure, in social and public universal services, to overcome discrimination that is structural, overcome conflicts, emergencies, and migrations, manage challenges that are proposed by climate change and digital transformation, and provoke change through new governance-focused approaches. I strongly recommend that you read this report because it offers interesting perspectives on each one of these topics. In terms of the Andean organ of health, we work with the instances of the Ministry of Health, and as a product of the COVID-19 pandemic, we drafted a report on how the pandemic aggravated inequality. In 2021, the ministers of the Andean region, the maximum authorities of the Andean intersectorial of the Andean region constituted the intersectorial Andean work table with the ministers of health of the 6 Andean countries. The Pan American Organization of Health was thus born, and the secretary of the Andean Health Organ. One of the first communication of these ministries, one of our first courses of action was to agree on a framework and a course of action. We informed on different publications on inequalities, and we published this report, which was called Social Inequalities in Health. It is a work document, and you can find this on the webpage of the Andean Health Organ, because this is where we show a situational analysis for the 6 Andean countries and the big challenges that we have connected to, for example, the Gini coefficient, which, as we all remember, is a statistic measure that is very important and is used to measure inequality in the income distribution among the population. And if we look at the data of the Andean countries, 2019, 2022, 2023, 2024, 0 represents inequality, and the closer we get to 1, then that would 0 represents equality. So the closer we get to 1, the closer we get to maximum inequality. We also see life expectancy, which we can see after COVID-19 dropped, and there are huge challenges in the sense of the life expectancy indicator. In the Andean table, within the conceptual framework, we propose that it was not enough to analyze inequalities in income, because inequality and they're multiple and they're diverse. On top of the inequality of income, which is very relevant, the gender inequalities, the generational inequalities, the ethnic and racial inequalities, territorial inequalities, human mobility inequalities, those connected to capacities, and ecological inequalities are also important. This is a map which, in the study of these inequalities, we reviewed a lot of documents, and one of the most important sources was CIPAN, which was the Latin and Pan American Health Report. So the social inequality matrix in Latin America is comprised of structuring points which express socioeconomic inequalities, gender inequalities, ethnic, racial, territorial inequalities, among many others, which have been around for a long time, and that this is intersected and strengthened throughout the life cycle, and it conditions the way one is able to exercise one's rights. And one of the rights that is infringed upon the most is the right to health. And in this publication, you will see a lot of data that was cross-referenced in terms of multiple inequalities. Here I have one example, and as you can see, the poverty is much greater depending on resiliency. For example, whether they live in an urban context or in a rural area. If we are talking about an elderly person, an older person, or a child, but elderly people also are at a greater risk of poverty. We can also see this based on the ethnic and racial condition. The African indigenous descendants are much poorer than those who are not, and the educational level is much lower. Or the lower the educational level, the higher the risk of poverty. As part of the sources that we worked and that we read as part of this work table for the Inequality Report for 2022, this is a very interesting report that says that almost all the regions, except Europe, almost all the regions, the 10 richest percent of the population concentrates over 40% of income. The 50% of those below the poverty line get only 15% of the total income. And inequality is the result of political decisions, and there are tools and historic examples to reduce inequality. There's a lot of evidence, many books of theory, of science, of economists who say that inequality has been reduced in history with progressive systemic changes, investment in public services, good social policies. So the strengthening of the state of welfare has shown to be effective to contain inequality. Public policies are key determinants in the eradication of inequality. So, for this reason and with this premise on the relevance of public policies, the Andean Intersectorial Table proposed, and the proposal was approved by the Ministers of Health in the ordinary meeting in November of 2022. The ministers approved that the Andean work table were to inaugurate with their intersectoral and participative approach the Andean Council for the Reduction of Inequalities. Within this premise, the Andean Health Organism conducted several web seminars on this topic. One of them is Inequality Kills, with very conclusive evidence in relation to how inequality affects health, where 21,300 people can die because of inequality. That is, every 4 seconds, a person might pass away or die from problems caused by inequality. Hunger, for example, kills 2.1 million people per year. According to this conservative study, over 230,000 people could lose their life in poor countries because of the climate crisis. And it's the most those who are the biggest millionaires are the ones who affect this problem, exacerbate this problem the most, and those who are affected the least are the poorest. So this is once again connected to justice. The talks that we have heard in these web seminars indicate that inequality is not an accident, rather it is the result of political decision. And so economic violence is important because it emphasizes the structures that perpetuate inequality. Likewise, in the publications and in the webinars, we have emphasized the importance of improving public financing of health because without a doubt, this means improvements to universal access. I am not going to enumerate all the activities that we performed with the Andean table when it comes to diagnosing on how we are monitoring inequalities, on all the different tools as a goal to create analysis reports of how these multiple inequalities affect key indicators of the report of sustainable development, and specifically the objective number 3 of sustainable development. We have performed workshops with great emphasis on the importance of conducting an analysis of inequalities with a focus on a social determinant of health. That is, we do not want to rest on our laurels of simply analyzing economic inequalities. Rather, we want to work on the reports that analyze what happens, what differences there are in relation to education, occupation, income, gender, environment. So, to go into the model of the most significant results when it comes to the relation of the work that we're doing, the Andean table performed this consultation process with the delegates of the health ministries on the key objectives that an Andean policy should have. And on top of that, the workshops, on top of the progress made on monitoring reports, we also worked on the policy document. On the meeting between the health ministers that took place on May 15th of this year, the health ministers approved the Andean policy for reducing inequalities. What is the proposed goal? To contribute to strengthening institutional capacities to reduce inequality in health, to deal with the social determinants, the cross-sectional work, integration, and regional cooperation, to achieve Sustainable Development Goal number 3, to guarantee a healthy life and promote wellness for everyone in the Andean region, and to allow them to exercise their right to health. These are several of the strategic measures. The first one has to do with strengthening institutional capacities, improving the informational systems with an equality approach, and we have also proposed conducting a permanent analysis of social inequality with an intersectoral approach. Likewise, we have proposed other strategic lines that were very much connected to dealing with the social determinants of health and strengthening the capacity of the human resources. Line 4 is strengthening governance and rectorship in public health policies with a focus on human rights and strengthening social determinants. Line 5 is developing strategies, cross-sectional strategies, policies, programs, and projects that emphasize this type of work to reduce inequalities. Line 5 is knowledge connected to the reduction of multiple inequalities. 7 is strengthening strategies that are oriented towards social appropriation of knowledge to reduce social inequalities in health. Number 8 is strengthening the Andean work table and other practicing communities to reduce inequalities. And line number 9 collects several elements, several priorities that we have called strengthening tools such as digital health, primary health care, socio-environmental health. And we have great hope to articulate all these efforts and initiatives to continue moving forward with the reduction of inequalities, to be able to contribute in the acceleration of the compliance of the Sustainable Development Goals. As you can see, in the Andean region, we still have many goals and indicators that are red, and so our vision is that by 2030 we want to have significant results when it comes to the Sustainable Development Goals, number 3 and number 10, which is something that all our countries have in red. Health for us is a bridge towards peace and well-being, and therefore happiness and well-being. It should be in the center of all the policies. And as Dr. Van said, evidence shows, and common sense shows this, we are happier if we have better health. And I cannot fail to mention, as part of this optimistic call for health, cooperate and articulate, because together we're stronger, together we can get further. Thank you so much. Thank you so much, our dear Magister Berta Luz, for the presentation that you gave us today. We went over all the multiple policies in health that represent some specific goals and action lines that represent not only wellness but also even happiness to a certain degree as a representative of health. And the sociologist mentioned that it is no coincidence that those countries that are that take up the first places in happiness also take up the first places in human development. Regarding the policy that you just mentioned, that is promoted by our organ and the Committee of the Andean Table, they do not only hope to reduce gaps between the most vulnerable parts of our population and the rest, it also recognize the use of a traditional medicine. So the connection is clear. We cannot have genuine happiness as long as inequality, structural inequality persists. That stops our Andean region from accessing quality health, maintaining their cultural traditions, and actively participating in the decisions that affect their well-being. Thank you so much, dear sociologist, for your presentation. We ask you to remain in the room, and after the conference, we will have a brief dialogue to answer the questions. Before we move forward, I would like to thank everyone who connected from the Ministry of Health, from academia, from the different social organizations, and especially the countries who are present in our chats: Argentina, Bolivia, Brazil, Canada, Colombia, Cuba, Ecuador, Spain, Denmark, Italy, Mexico, Nicaragua, Paraguay, Peru, and Venezuela. We have received many greetings and congratulations. So before we move on to the dialogue and the answers, we would like to start with an active pause, because after these learning moments and exchange of knowledge, it is necessary to take some time to relax and have a small session of physical exercise during your work time, especially during this webinar. Horace Kono incentivizes the well-being of those of you who are with us on this webinar. So for the next few moments, we will offer an active pause to reduce fatigue, stress, and keep your muscles flexible and healthy. Go ahead, please, with the active pause.
Buenos días, buenas tardes. Desde el Organismo Andino de Salud, Convenio Hipólito Unanue, estamos muy felices de recibirlos en esta actividad saludable. Hoy vamos a aprender unos golpes de artes marciales para llevar estilo de vida saludable a nuestro organismo. Así que, guardia, perfecto, cuando estés en guardia separa las piernas y regálame un balanceo, ya mire, lado y lado. Perfecto. Energía positiva para todos el día de hoy. Vas a ir a guardia y quiero que empieces a hacer un golpecito al frente. Esa es la actitud, con energía, con fuerza. Hoy Bolivia, Chile, Colombia, Ecuador, Perú y Venezuela trabajando juntos a través del Horas Konu para favorecer nuestro estado de salud. Ese mismo golpe arriba, mire, grande, amplio, generoso. Mueve esos brazos, energía positiva. Eso es, perfecto. ¿Qué tal si me regalas ese golpe al lado? Mire, lado y lado. Eso es. Perfecto. Lo único que te falta es la sonrisa, la actitud, la fuerza. El que se quede quieto gasta refrigerio. Perfecto. Mire, golpe del codo, el golpe de ala. Esa es la actitud. Nos fuimos. Mueve esos brazos, esos codos, esos hombros. Perfecto. Y después de eso, siguen los ganchitos. Mire, ganchitos de abajo hacia arriba. Si se puede. Muy bien. Movilizando los brazos. Energía. ¿Qué tal si empezamos de cero ahora? Al frente. Muy bien. Perfecto. Podemos contar todo de a 8. Mire, arriba. 1, 2, 3, 4, 5, 6, 7 laterales. Mire, 1, 2, 3, 4, 5, 6, 7. Siguen los codos. 2, 3, 4, 5, 6, 7. Ganchito, mire. 1, 2, 3, 4, 5, 6, 7, 8. Regáleme, mire, la perita del boxeador. El que lo haga más lento gasta algo. ¡Vamos! Organismo Andino de Salud, Convenio Hipólito Unanue. Los quiero ver activos, llenos de energía, como siempre, felices, saludables. Eso es. Bueno, ojo, vas a ir a guardia y regálame rodilla arriba. Rodilla arriba. Energía, nos activamos. Perfecto, vamos a marcar el abdomen. Entonces, mire, bajo los brazos cuando sube las piernas. Eso es. Sonrisa. Así hasta las 10 de la noche y vas a ver cómo sudamos y tonificamos todo. Perfecto. Bueno, vamos a empezar todo desde cero. Entonces, sepárenme las piernas y arranca. 1, 2, 3, 4, 5, 6, 7, arriba. 1, 2, 3, 4, 5, 6, 7, laterales. 1, 2, 3, 4, 5, 6, 7, los codos, mire, 1, 2, 3, 4, 5, 6, 7, los ganchitos, mira, 1, 2, 3, 4, 5, 6, 7, peritas, mira, 1, 2, 3, 4, 5, 6, 7, arriba rodillas con energía, 3, 4, 5, 6, 7, 8 más, mire, 1, 2, 3, 4, 5, 6, 7, una sola pierna, mire, 1, 2, 3, 4, 5, 6, 7, 8 y cambio, 1, 2, 3, 4, 5, 6, 7 y 8. ¿Cómo vamos? Activos, calorcito, energía positiva y con estos golpes de artes marciales lúdicos para llevar actividad física a nuestro cuerpo. Separe las piernas, guardia, balanceo, energía. ¿Cómo están en Bolivia, en Chile, en Colombia, en Ecuador, en Perú, en Venezuela? Conectados, esa es la actitud. Todo cuenta conmigo, mire, 1, 2, 3, 4, 5, 6, 7, arriba, 1, 2, 3, 4, 5, 6, 7, laterales, 1, 2, 3, 4, 5, 6, 7, los codos, 1, 2, 3, 4, 5, 6, 7, ganchitos, eso ya se lo aprendieron, 3, 4, 5, 6, 7, arriba, mire, 1, 2, 3, velocidad, eso, siguen las piernas ahora, mire, 1, 2, 3, 4, 5, 6, 7, una sola, 1, 2, 3, 4, 5, 6, 7 y últimos 8, mire, 8, 7, 6, 5, 4, 3, 2, 1 y ya, golpe al frente. Es un golpe de liberación de estrés, de tensiones. de energía negativo. ¡Ya! Al frente, listo para finalizar. Bueno, guardia, última secuencia y terminamos. Guardia, perfecto, energía, eso, sonrisa, balanceo, perfecto. Necesito los más coordinados y saludables de todo el Orasconu aquí conmigo. Guardia, energía, yo le aviso. Tome aire, vamos con toda. 4, 3, 2, nos fuimos. 1, 2, 3, 4, 5, 6, 7, arriba, mire. 1, 2, 3, 4, 5, 6, 7, laterales. 1, 2, 3, 4, 5, 6, 7, los codos. 1, 2, 3, 4, 5, 6, 7, los ganchos. 1, 2, 3, 4, 5, 6, 7, 8 pelitas, mire. 1, 2, 3, 4, 5, 6, 7, piernitas, rodillas. 2, 3, 4, 5, 6, 7, una sola pierna, energía. Eso es. 4, 5, 6, últimas 8 y prepara el golpe antiestrés. 3, 4, 5, 6, 7, que se oiga. ¡Ya! ¡Eso! Liberación, que se oiga. Perfecto, que se oiga en Bolivia, Chile, Colombia, Ecuador, Perú y Venezuela. Este grito antiestrés hoy desde el Organismo Andino de Salud, Convenio Hipólito Unanue. ¿Cómo la pasamos el día de hoy? Tome airecito, grande, grande. Exhale, descanso. Muy bien, toma airecito. Exhalo y descanso. La tercera la vencida. Fuimos airecito. Exhalo. Muy bien. Mire, el Orasconu les agradece por regalarse este tiempo de estilo de vida saludable. Los animamos a seguir haciendo pausas activas divertidas para favorecer nuestro estado de salud. Un abrazo. Chao, chao.
Bueno, terminó nuestra pausa activa.
Well,
Esperamos
that is the end of our active
hayan
pause.
disfrutado este ejercicio virtual.
Hopefully you have enjoyed this virtual exercise.
Le pedimos para iniciar
So,
este espacio de diálogo,
to begin this dialogue space,
preguntas a partir de de los comentarios que dejaron en nuestro chat.
we will look at the questions left in the chat.
Voy a iniciar este espacio
I
haciendo
am going
preguntas para
to open
todos.
this space asking all of you a few questions, and this way we can make the dialogue a bit more dynamic. Likewise, if anybody wants to contribute anything to the other person's question, you can do that as much as you like. So, Dr. Ben, I have the first question for you, which says, the richness has been seen as a social determinant for a long time, and it can be extrapolated as a social determinant for happiness also. But you wrote in your book, Happiness 2023, but that there is a plateau. There's a limit to that association between wealth and happiness. So in that sense, what thoughts can you tell us about this idea mentioned in your book and the strong levels of global inequality, and also from our own Andean perspective, our own Andean area?
The reason I'm saying what I'm saying is that, to put it rather simple, we think in economics that you have a diminishing utility curve, implying that if you have higher income, you can buy more goods. But as I tell my students, most students are happy with perhaps 2 or 3 beers, but they become stupid when they have 10 beers. So they have a diminishing utility curve. This implies that you cannot just expect this to increase. There's also a formal argument for this is not possible, because the way we measure happiness is to ask people how happy they are. At the maximum score can be 10. So even if you become happier, would you go from 8 to 9 or from 8, 9 to 10? So that implies that you can't do it. Still, I would argue that for low-income countries, becoming richer, have a more equal distribution of resources, would imply that citizens in general will become happier. So even if this is the case within a country, and also in a sense across country, as you can see on the data from the World Happiness Report, being able to have better living conditions and higher level of income will make it a better life and more happy life for many. Of course, there is this contradiction with the whole the whole issue about climate change, that there's the risk that continuous increase in production can have a negative impact on the climate change. So one should think about how can you combine growing economic prosperity, growing equality, with a better climate action to make it, in a sense, stable also over a longer time than just a few years.
Muy buena reflexión y justo considerando
Great
que
point, and especially if we consider that a sociologist who talks about this impact
y como además la salud mental también es en parte del
even on
indicador
mental
que
health,
mencionaba
because it's
Fernando.
part of the health and happiness indicator.
Me voy a permitir ahora hacerle una pregunta
So I will allow myself to
Marcelo,
ask our
y
sociologist a
luego el
question,
doctor
and
especialista
then,
también puede
Doctor, if you like, you
intervenir
can
en
also
parte de la pregunta que
participate
quisiera relacionar a ella.
in the space of the
Entonces,
question that I will ask.
socióloga dice así,
So,
respecto a los datos,
sociologist,
la
the
desigualdad
question is the following. Regarding the data, the
de
inequality
21.300 personas
contributes to the death of at least 21,000 people every day. So what are the proposals to reverse the trends of economic inequality?
Muchas gracias.
Thank you so much,
Muy interesante
Yadira.
la pregunta.
The question is very interesting, and
La respuesta la puedo dar
the
en
answer I
base
can
en
give with an
muchas de las
emphasis on
publicaciones que hizo Osvaldo y en uno de los
one of
webinars
Oswald's
que
publications,
hicimos este año
one of the
donde se
webinars that we
presentó.
conducted this year that was
Ellos
presented.
plantean la necesidad
They
de una
propose the
reforma
need
fiscal
to have a
progresiva y
fiscal
justa.
reform that is progressive
La
and
propuesta
just.
de reforma
And
fiscal
part of the proposal of this
plantea
fiscal
varios
reform, they
desafíos.
propose several
Uno de ellos
challenges.
es los
One of them
impuestos a la
is
riqueza,
the
implementar
tax to
impuestos
wealth,
a los
implemented
más
tax to
ricos
wealth
y a
to
las
tax the
personas que
rich,
tienen más fortuna para
those
redistribuir la
who have
riqueza
the
y pagar
greatest
a las
fortune to
grandes
redistribute
empresas y multinacionales.
wealth,
También en
the big
este punto
multinational
dice que la
companies, and
reforma
also part of
fiscal
this
progresiva y
component,
justa
the
se
progressive and
conforma o se
just wealth
trata de
report
eliminar paraísos fiscales y la
calls
evasión.
to
Hay un punto
eliminate fiscal
que
evasion.
enfatiza
There's a
Oswald,
point that
que es la
Oswald
inversión en los
emphasizes, which is
servicios
investment
públicos
in
y
public
universales,
services and universal services,
pensando en salud y educación gratuita y de calidad
emphasizing
y
health, free
protección social
education,
para
social
todas las
protection,
personas, que es un derecho
education,
humano y que en
which
la
are human rights for everyone, and in the Andean region especially,
tienen. Por
are
otro
still lacking.
lado,
On the other
se
hand,
plantea una recomendación
a recommendation was
de
proposed
encontrar un
around
reequilibrio de poder
achieving a
económico
rebalance of
y
economic
se hace
power,
mucho énfasis
and
en mejorar las
a lot of
condiciones
emphasis is put on improving the conditions of the
avanzar para
workers,
lograr empleo formal,
moving forward
decente,
on
mejorar
providing
salarios,
people
condiciones
with
laborales, derechos
dignified
laborales,
labor, with
sustentabilidad,
union rights and better
así
work
como
conditions, and it
reducir
is seen as
brechas
fundamental, as well as
salariales,
reducing
limitar
salary
diferencias
gaps,
salariales.
limiting salary gaps.
También hay unas grandes diferencias
We
entre
see
los
that there are
hogares
companies that
y
have huge differences between those who
esas
earn a lot
diferencias
and
no
those who
deben
earn little. So
existir.
those differences should not exist, says a
Cuando se
sociologist, but
plantea las
when
recomendaciones para reducir
he proposes
desigualdades,
recommendations to reduce
mejorar el salario de
inequalities,
las personas que
improve the
usualmente
salary of
están
people who
más bajo en la
are
escala
usually
socioeconómica
lower
es
in
una
the
buena
salary scale.
recomendación.
This is one of the ways of
Asimismo,
doing it.
Osvan nos
Likewise,
recuerda
Oswald reiterates, promotes gender equality, racial equality by implementing policies to eliminate structural discrimination. The concept of structural discrimination is important in the sense that we know that there are populational groups that are more affected by the inequalities. For example, migrants, indigenous population, or African descendants. Finally, it is reiterated that it is fundamental to bring together all the possible efforts to accomplish an economy or society that is more equal, especially in response to environmental issues that contributes to the participation, to social participation. And I cannot fail to mention that from the health sector, we have many recommendations. One of them is the one that I presented regarding dealing with different social determinants of health and the Andean policy for reduction of inequalities.
Muy bien, muchísimas gracias.
Excellent. Thank you so much, Berta
Una
Luz.
reflexión muy interesante.
This is
Yo
These are very interesting thoughts. I will also ask another question. I'll ask the professor another question, and it's also quite critical, or maybe even suspicious from the point of view of public health. How can we integrate the measuring of health and wellness from our system of surveillance and planning? Professor, go ahead.
I'm not sure I completely understood your question. So could you repeat the question once again?
Sí, la pregunta
Yes,
señala de
the
que
question
desde la
says
perspectiva
that
global
from
de
the
salud,
global perspective of public
podríamos
health,
integrar la medición de la
we
felicidad y
could
la bienestar
integrate
a los sistemas de
the
planificación.
measures for health and well-being into our systems, into our planning systems,
Aunque es algo mucho más
although it is
Yeah,
something
you
much
can,
more.
you can do it, and I mean, it has been used. I mean, a lot of countries have well-being institutes, well-being researchers, and think they're saying this should be important. So one way of doing it is to ask decision makers, because they take the decisions by the end of the day, to say to them, we're not only interested in, for example, economic growth, we're also interested in taking the steps to improve the level of happiness. So they could integrate and saying, what is important for us, we will do that, even if we cannot show that this is important. Let me give you an example from the Danish discussion. There is no evidence in Denmark, at least, that have more police on the street could improve safety, security in daily life. But for some people, especially elderly people, it is seen as important to see some police somewhere. It gives them a feeling of safety, and therefore they become happier. So therefore, you can say sometimes it might be good to do something which makes people happier, which can have an impact other places. And the same goes for that I indicated in my speech, that it might be that one should be more aware of how can we support, for example, that people participate in different kinds of sports. If they can be active there, meeting other people, getting social contact, then they will become happier. And this could be an argument for spending money on this one. And I also agree that if policymakers would do it, it would be good to ensure that everybody can afford a good meal at least every day, because food is an important element in being healthy and thereby also being happy. So avoiding to be constantly worried about what should happen next, because as some I think was Indian economists have shown, if you're worried about where your next food should come from, you will get what they call a tunnel view, because then you will only think about the next meat, but not about how to improve, for example, your education, contact with others, and you do not have the surplus as individual to search for other ways of having a better life. So ensuring a good ability to buy healthy food can be an important issue.
Sí, justamente la pregunta que venía
Yes,
para el
actually,
siguiente
the following
punto viene muy
question
ligada a lo que usted
was
mencionaba de
tied to what you just
legisladores
mentioned regarding the
y cómo
policymakers
podemos
or
propiciar
decision
para
makers, and that
tener
is,
las autoridades
how can we allow to have competent authorities that know all this that we're talking about health and about happiness and the determinants, so they can apply this in the public policies that they draft. Because, for example, we have a regional context where many legislators do not have the skills, this short and long-term view.
No, and that is a classical issue, and it's a difficult issue to answer, because to my mind, at least, democratic decision making is the best way of making decisions in a society. So I think the best way is to try to provide information, making data and analysis, and show what's important. But even just to give an example from a European discussion, there has someone who have tried to ask people whether they would be in favor of a tax on carbon dioxide. And a lot of people are against such a tax because they believe they will have to pay for it. On the other hand, if you could show that a carbon dioxide tax will mainly be paid by the rich people and be used to make a better life for those with low income, then there would be support. So I think in a way that research showing something about what is the preferences of the voters can have an impact. But it's a long way, it's a slow way. But I think information, knowledge is the best way to try to change in this direction, given we in many ways can indicate that having a good life, being happy, also, and that could perhaps be one issue to raise to the private sector, happy workers are more productive than less happy workers. So there can also be a benefit for private companies by getting happy people because they are working more effectively.
Así es, evidencia para la toma de decisiones, que
And that is
siempre
true evidence for decision making.
desde ese punto y esa mirada.
A point of view that we always talk
Importante también lo que
from and
mencionabas,
about. And
trabajadores felices.
what you just said is important. Happy workers are more productive, and there are, in fact, large companies that are applying this strategy of having a sort of a articulation of a space for recreation, for example, to promote happiness and promote productivity.
Entonces, tengo acá otra pregunta.
So I have another question here for Berta Luz, and it says, well, in regards to the World Report of Human Development for 2025, it was determined that it was a matter of choice in the era of artificial intelligence. Perhaps you can mention some ideas in terms of the connection with AI and how it can enrich human development. Go ahead, please. Thank you so much, dear Yadira. I know that you love this topic and that you have dealt with the Andean Committee on Digital Health very well, and I really loved the report that when I reviewed it. Those of you who are interested, hopefully you can give it a read, because it proposes that while artificial intelligence moves forward quickly and is a promise to transform society, the progress of human development is still stagnated. However, the outlook is not pessimistic. This report proposes that there is still a central role the people play, which is why the report highlights that the future of artificial intelligence is not determined by technology itself, rather by the human decisions about its design, its development, its application. So it is a call to for the artificial intelligence to be seen as a tool that can empower and increase human capacities, and it is not a way to substitute people. When it comes to challenges and opportunities, this report proposes that the great challenges, because in one of the webinars, we already talked about this, and it's that artificial intelligence can increase existing inequalities if it is not implemented, if it does not, we do not tackle current injustices, then artificial intelligence can perpetuate and increase this injustice and these inequalities. However, it is important to invest, as it was proposed in other discussions, in human capacities, in equality and equity, and human skills. It is also without a doubt important to understand what beliefs we have when it comes to artificial intelligence, and especially how we can contribute so that it is used for the well-being of the population, and so that we can use it to reduce, to contribute to the studies in different ways, to training, to strengthen human development and reduce injustice and inequality. That is true. Thank you so much. Interesting topic. We always talk about the gaps, though that is a tool that supports It is also a tool that can increase gaps, especially in countries that already have them and have all these different problems. Berta already shared a lot of information on the topic, and I'm going to make the last question round so that I don't abuse too much of your time. For you, Professor, I have one, even though you kind of already mentioned this before, and Berta Luz also talked about this. I would like for you, from your academic position as a professor, to maybe give us your thoughts, and maybe we could also talk about how this connects to our region as a practical exercise. What is the role of education and health promotion in creating awareness about the importance of happiness for the collective well-being and collective health?
To my mind, there's no doubt that a high level of education is important. It's important to inform people about what is a healthy lifestyle without expecting that all will follow the advice, but giving advice is important. The more people who have some basic education, making them able to read and write, will improve and increase the probability that they will live a healthier life. So this is very important. I mean, and we can also see from data about happiness that the longer education you have, the happier you are. Again, there's this risk that there's a confounders of income, etc. In these respects, but nevertheless, education is very central in a sense, not only for happiness, but also for having a job, living a fulfilling life, and therefore education is in many ways one of the preventative measures we can take to ensure we have a population who are willing and have the options to participate actively in society. And education might also imply that people meet other people, that they can make social capital. And this is important also in relation to health, because we know that our health deteriorates over lifetime. We have the Grossman discussion about how your health deteriorates gradually from your 2025. So therefore, it's important for the people know that they have to do something to keep as best as possible an active life, because an active life will reduce the pressure and the risk of a number of diseases. So in this sense, here, as in many other policy areas, education is very, very important and very, very central, and becomes more and more related to the question about AI, not only to have a basic education, but have a continuous lifelong learning.
Así es.
That is true.
Muchísimas gracias,
Thank you
querido
so much,
profesor Ben.
dear Professor Ben. Education is always going to be a super powerful tool for every society, and we need to continue working and promoting on the new technologies and all the new advancements to be included in schools so that the kids are updated. This is work that we still have to do. I think this requires a society-wide response, a support from tutors and professors who follow up on this pedagogic process. I have one last question for Berta Luz, and it's with my deepest affection is how the Andean work table can collaborate with the Statistic Institute to create disaggregate data that that allows us to quantify social determinants. Yes, I like this. Since 2022, when we began the exercise of drafting this report in monitoring inequalities, based on this, we were not happy to simply calculate the national averages or with some data of intersection of, let's say, income inequality, but also connected to these other multiple inequalities of gender, of territory, clinical and others. So the great challenge was to find information. And we had meetings with the National Health Institutes. So in that first encounter in 2022, the delegates of the national institutes showed us their data the information and offered the Andean Intersectorial Table support in their process. We have kept the invitation for them to participate in the meetings and gatherings of the Andean Work Table, and the countries in most cases have maintained a connection between the focal points of the Ministry of Health and the people from the National Health Institutes that were in charge of collecting the information. We currently have a great challenge, and it's because the product of these workshops, the delegate of the Andean Work Table, they're working on drafting the reports. What is the challenge? Well, after the information is given, it's to calculate the stratifiers of the multiple inequalities. It has not been simple. However, we think that this year the countries are going to be able to have a first report, which for us is very important in the sense that baseline, not secondary source, which are relevant, of course, but rather of the information collected by the health ministries.
Excelente. Están
Excellent.
haciendo un trabajo muy interesante
You are
para
doing some very interesting work for the region.
Andina. Sin embargo,
From the
todavía
Andean
tenemos muchos
table,
retos.
there's still many challenges left. Likewise, I still congratulate you because it is always valuable to have commitment and participation to move forward. Well, due to time constraints, Professor, we want to thank you. I want to thank everybody for all the questions you asked. We weren't able to answer all of them, but hopefully in our next webinars, we'll be able to answer more. So we want to thank everyone's participation. And to close out the space of the cycle of Q&A, I want to ask each one of the speakers in the same order in which you spoke to leave us with a final message. So let us begin with you, our dear Professor Bent, with your final closing message.
Always keep up the good spirit, always try to have a happy day, and try to help others have a happy day.
Qué bonito mensaje.
That is a beautiful message. Thank you so much. We have to be happy, and we have to cheer up others, make other people's lives happy. So go ahead, dear Berta Luz. Yes, I will take two quotes that I really liked. One is from a spiritual teacher who says, "A world full of love, light and laughter. The time has arrived. Let's make it happen." And the other quote that I liked from a sociologist, "Inequalities are produced and are sustained socially through many mechanisms: exploitation, exclusion, hierarchization. However, any exhaustive analysis of inequality must deal with the possible ways of overcoming it. In fact, for each mechanism of inequality, there is the corresponding mechanism of equality." Lovely. Thank you so much for that closing message for everyone here. And well, we reiterate our thanks for the wonderful presentations, the dialogue, our speakers today, Berta Luz Pineda, Professor Ben Grave, and of course, the Copenhagen Institute for Future Studies. I don't know if Dr. Bocci, who is here, would also like to give us some final closing words before we pass it on to Dr. Luis Bengolea, who will give us our final institutional closing message. Go ahead, Dr. Bocci. Yes, thank you so much, Berta Luis. And this was very interesting. In a way, we've heard things that we don't often hear in health. We usually talk about advanced treatments, which we of course do need, but we always need to remember that there are root causes, which are very important if we want to improve, that we need to improve, and we need to have sustainability and better partnerships. So I am very happy that we were able to collaborate on this, and thank you both so much for being here today. Thank you. Thank you, dear Dr. Bocci. And now for the formal closing, I give the floor to Dr. Luis Bengolea, the coordinator for Health Without Frontiers from Orascona, who is going to, on behalf of our executive secretary, deliver the formal closing. Go ahead, Dr. Bengoleon. Thank you so much, dear Yadira. On behalf of Dr. Maria del Carmen Cayagavila, executive secretary of the Andean Health Organisms of the Hipólito Unanue Convention and the full Orascona team, I want to thank everyone present for your valuable participation in the space of collective reflection. Today, and through the brilliant presentations, we shared evidence, ideas, experiences that allow us to reaffirm a fundamental principle. Happiness is not an abstract concept, and it is not something removed from public health. Rather, it is an expression, a specific expression of individual well-being and collective well-being, and it needs to be part, a fundamental part of health policies of our Andean countries. For the longest time, the concept of wealth, of material wealth, was considered the main determinant of well-being. And just as Dr. Ben Graves said in his book on happiness, we know that this relationship has a limit. And he showed us a brilliant example of the young people who drink too many beers. They are happy only to a certain point. Beyond a certain threshold, the increase in income does not translate into more happiness, which is a great thing to learn. However, what does impact directly on health and well-being is what both speakers mentioned. It's equality, social justice, universal access, essential services, basic services, social trust, and the freedom to live a dignified life to live with dignity in a space where you're given dignity. So we think that Orascona is going to continue working on a transformative vision of public policies, as Yadira also mentioned, in the incorporation of our plans, of our strategic plans and institutional plans for the year 2020, where happiness is not understood as an individual luxury, rather as a collective responsibility and a measurable result of our decisions, of our health decisions, social decisions, and also economic, and is a measure of our health, wellness, and social and economic decisions. What can we move forward on collectively? I think that it is important, just as you have said, and to summarize, it is important to integrate the subjective health and wellness indicators. That is to say, we should not only count numbers, we should also look at capacities and options to move forward in the application of our policies. Likewise, I think it is important to strengthen the policies that promote health and emotional education. It is fundamental to improve empathy, resilience, the sense of community. The community empowerment is also key. It is necessary for our community to be strong, to know more, to be better organized, and be better informed. And from the structural point of view, intersectorial cooperation is key. We cannot move forward with new policies if we do not intervene strategically. And finally, we have to assess collectively all the public policies. We have to analyze and evaluate how far we've come. We are very happy here as part of the Andean Health Organism, and we reaffirm our commitment to continue promoting comprehensive policies that are humane and sustainable. We are talking about the fact that it is possible to live healthy and happy, and that it needs to be a real right and not a privilege, just as it has been concluded this meeting. I want to offer my special thanks on behalf of the doctor as well and the whole team of Orascono. I want to thank Dr. Bojan Eliasen, who constantly collaborates and contributes and who always pays attention as the Copenhagen Institute of Future Study director in the development, is always attentive in when it comes to the development of strategies and policies together with Orascono. Dr. Ben Graves, the professor of the Sciences Department, Social and Entrepreneurial Sciences Department of the University of Rothschild, who has given us a brilliant presentation and who has shared his personal experience and professional experience. To sociologist and dear friend Berta Luz Pineda, our dear friend and a professional who conducts intense work in this field of disabilities, of climate change, and other areas that are important for Orascono. And, well, to close out this event, I wanted to remind you that we are going to have another webinar, number 285, which will be about the prevention of spina bifida, key for a healthy future. This will take place on June 26 at 11 a.m. Peru, and I will be in charge of moderating. On behalf of the whole team, I want to thank everyone, Yadira Salas, for her excellent preparation and for hosting this webinar, the full support team, and who has made this meeting possible, and also our chief, Maria del Carmen del Calle, Maricela Maite, who are currently on a work mission, and the whole team of the Andean Health Organism. My best wishes to everyone. Thank you.